Okay, we're gonna start where we left off yesterday, and I think we just had talked about arthritis in chapter 4. It's page 78. And we did talk all the way up until, well, we'll just go with arthritis. Arthritis is a general term that refers to inflammation. And we keep talking about that itis is that inflammation. If I can just, yep, use your highlighter. And that's the swelling of the joints. It causes stiffness, pain, and decreased mobility. We know what arthritis is. It's not a good thing, and you normally get it as you age, or unless you are younger and have injuries, it'll show up on you quicker too. They told me I would have arthritis in my knees, but I'm 45. I ain't got it yet, but they pretty much guaranteed it because I've had 2 knee surgeries, and that's what follows longer later in life. Arthritis can be a result of aging or injury or autoimmune illness. What that means, it causes the body's immune system to attack normal tissue in the body. Underline it. And they probably won't even go that deep when they're asking questions. Causes the body's immune system to attack normal tissue in the body. Right up under autoimmune. Or right a couple of sentences under.
Okay.
Rheumatoid arthritis, if you look at the picture, you see it deforms the hands. How I describe it, it's like it makes your joints very soluble, and then they heal back together and they're kind of stuck together. And that's kind of what your rheumatoid arthritis is. They become red, swollen, very painful. Deformities can result. A lot of times they have fever, fatigue, and weight loss. But that's it's your body messing with itself. And when you get rheumatoid arthritis, people they'll tend to have first sign would be them thick knuckles in your fingers. Osteoarthritis is what most people are aware of. It's also called degenerative joint disease, degenerative arthritis. That's mostly your older people from joint and hip injuries, hips, knees. Mostly your weight-bearing joints, even your fingers, thumbs, spine, all that can have osteoarthritis. And that's what most people are afflicted with as you get older. And hopefully we won't have it, but they try to say it's almost a guarantee. But again, that's not normal. It is meaning something's wrong. They normally give them anti-inflammatory medications such as ibuprofen. And what that does is burn your lining in your stomach. That's why when they say and they tell you to eat something with your medication, they mean it, because ibuprofen will eat your stomach out. So be careful with ibuprofen and a lot of meds. And a lot of meds work better with food because they need the nutrients out of the food to even work better. So when they say eat your medication with food, they mean it. Even for your patients, if it says eat with food, they need to be eating something. So remember that if you ever have to remind people to take meds or anything like that. Or if you come on along and get to be certified medication aid or any of that kind of stuff.
You have opinion.
Guidelines. For arthritis, watch for stomach irritation. That's from that bad, it'll eat your stomach. Encourage activity. Sometimes they'll be slow to rise in the morning, just help them up. And a lot of people, even me, even children, they get slow in the morning, and same as your older people, they're slow. And then as soon as they work it out, they get where they can move a whole lot better. So just make sure that's there. Choose clothing that's easy to put on. Them snaps. Anything that can snap is a wonderful thing. Buttons, because you've got arthritis or rheumatoid arthritis, they are very hard to button. So if you can get them snaps or some easy buttons that they can do themselves. Or pull on shirts just like this right here. It's wonderful. Something that they won't have to fiddle with buttons. And even their pants. The stretchy pants, that's what a lot of people get from stretchy pants the older they get. They don't have to mess with buttons or zippers, and it's because it's hard for them to do. Help them with their self-esteem. Let them know that we understand, and that's why we're here to help. Osteoporosis is another thing that is also a problem. and mostly happens with women in menopause. It's a certain calcium and is what you need for your bones. And once your calcium is depleted, and when you hit menopause, that calcium does not get into your bones, and that's why it causes holes in your bones. So break that word down. Osteo, meaning bone. Porosis is pores. So it means holes in your bones. We're on page, just now on page 79. So, from holes in your bones, what you think? You're going to have some very weak bones, right? From osteoporosis comes a lot of falling. People actually break their bones, then fall. Or if they fall, then they break their bones. But from a lot of that osteoporosis, it's because their bones are so weak. Make sure they exercise. Believe it or not, weight on a bone actually causes healing. It causes the bone to become thicker. So get them to walking, and that'll help their bone structure. Hip fracture, knee replacement. Now this is part of your skills also. When people have hip fractures, bone fractures, remember the fracture is a bone. Sometimes people don't even realize they've broken something. I've actually seen a lady laying in the bed and her hip was broken. But it's a certain way they lie, like one foot will be just hanging like this, just hanging, while this one's there. And that's where they'll be lying, like these are their feet.
It looks so
cool. Yes, and it hurts, and I can't believe, even my mother, she had injured hers after she had a hip fracture, and she didn't know it, but she started having pains later. Then we took her to the doctor, and they kept her, but she was walking on it the whole time after she re-broke it inside her pelvis. But it happens. Remember, the elderly heal slower. This is what a lot of people get in the nursing homes. This is why they get laying in the beds. This is what they get, or when they start getting in a wheelchair and don't get back up because it hurts. Not only does it hurt, but they lose so much of their muscle tones when it's time for them to get back up and start walking. They just are so weak. It's hard to come back from that. So imagine you having that surgery, and imagine you have to get through that surgery. Imagine the older person going through that, and a lot of older people do. And this is when they don't get back up, though. We got to get them back up, get them back walking, even though it may hurt. Give them some pain medicine. Let's exercise, and they may be weak, but it takes exercise to make the muscles back stronger. So don't let them sit and stay, because that'll stick them in the bed forever. Hip. Sometimes a hip is fractured from an injury. Like I said, maybe they broke their hip, then they fell, because that's what osteoporosis will do. Little holes in your bones makes it weak, then you fall. Then sometimes you fall and break something, and we do that. That's me and my foot. But it can be caused either kind of way. After surgery, the person cannot stand on the leg until it heals, and you look at your doctor's orders. When they tell you to get them up, you get them up. Don't let them not get up. That's the whole point. We got to get them back up. They'll tell you when you can start putting weight back on the hip. For guidelines, keep often used items close to them, and that's what we do for everybody, right? But especially for someone who has a hip fracture or anything like that, keep their items close. And underline and star this one, because this is also one of your state skills. Dress the affected side first. Underline that. If it's the right side that's weak, we're going to dress that side first. Even hands, arms, whatever it is. Legs also. And that's your state skill. The skill that says dress the right, affected right, weak arm, something like that. That is your state skill. And that's why they want you to learn that, so you can use that even with your fractures. Yeah, we practice arm, but it's the same way on the legs. You put the bad leg in, and you never call it bad leg, but put the weaker leg in and then the other. Because you can easily put on pants a whole lot easier, or put your shirt on, because if you put your shirt on, this is your bad arm. You can't move it, but we can thread it on, and then this arm can, do all the moving and get the shirt on. And that's why you put it on the weaker side first. Never rush the resident. We already know that. And ask them to give them pain medication before they are to do any kind of exercises. Remember what your weight bearing means? All that means is they're either going to use a cane, crutch, but they will tell you what they have. So if they give you an order for partial weight bearing, that just means partial weight. That means some body weight on one or both legs. And underline that. And you'll probably have a test question on this because they want you to know that you know what that means. Partial means some body weight on one or both legs. Non-weight, what you think that means? No weight on either leg. No kind of weight. And when I had my first knee surgery, they told me non-weight bearing for 6 weeks.
Ooh.
And it was a long time, but they thought my leg would heal, but it didn't. But that's why they didn't want me to re-injure it.
So what you had to do? Just lay in bed and you really couldn't get up?
No, I used a crutch. Now, older people is not so susceptible to crutches,
Yeah.
but I crutched around. I just didn't put my foot on the ground ever.
So you like holding yourself up with crutches?
Yeah. And one leg. I was non-weight bearing on my right leg.
Oh, that's
Yeah.
the left. I know
Yeah.
that's hard.
Yeah, not both of them. And full weight bearing, what you think that means?
100%.
Yeah, they're good to go. They might be slow, but that means we can walk them, and we want them to walk. And underline that next one. It's very important. Never perform range of motion exercises on the operated leg. You know, our knee, ankle.
Yeah.
That also includes that hip moving. So do not do your range of motions on that one. Also, page 80, that first G. Caution the resident not to sit with their legs crossed. They cannot cross their legs. Because what it does is it pulls on that surgery site. And it's messing it up. They need to be in proper alignment, which is straight legs all the way down, even their feet at 90 degrees. 90 degrees straight up. The hip cannot be bent or flexed more than 90 degrees. Underline that too. And that means if they are sitting, even when they're on the toilet bowl, they only need to sit at a 90 degrees. Not, this is maybe 75 degrees. This is 90 degrees. They need to stay at 90. Because again, when they're leaning over, all that leaning over is pulling on that hip. Do not want to injure the hip. So they cannot bend and pick up anything. You need to go pick up for them. Put their things beside them. Putting on their shoes, no. Socks, you're going to have to do all that. Unless, they can do themselves, but they're going to have to sit up doing it. That's...
They can't bend down.
Mm-mm. They can't bend down. They have to do it sitting up. Most of the time they'll use adaptive devices, like a pincher that'll pinch them and put their clothes on. Mm-hmm. But most people have are helped up until that time, then they can start bending. Up under that picture, well, if you see the picture, they call that an abduction pillow. What does abduct mean? To take away from the midline, so they're not together. They are taken away. So we're going to put that pillow between their legs so they will not cross their legs, and that is a must. If you're turning them or doing anything, you're going to put pillows between their legs to turn them. Okay, that's your abduction pillow. Then right up under the picture, when transferring from the bed, use a pillow between the thighs. Underline that one. And come on down to them last two sentences. And you'll see a question about this too. Stand on the side of the unaffected hip. You want to stand on their strong side. Because you want them to start on their strong side. So if, just like I have my right, it's my left. So I would stand or start to walk on my stronger side. We would want to transfer them into a wheelchair on their stronger side. And that's going to be helpful for you. Because if you don't, then they're going to be weak and you're going to have to do most of the lifting. But if they got one strong leg, they can easily put that leg down and drag the other leg, just like I did for a couple of days. Drag it right on along. But that's how it works, even with you. If you was to have any ankle damage, you're going to do the same thing. You're going to walk with your strong and drag your bed. And that's what you need to do, is make sure you to help you in transferring, you need to be on their stronger side. The strong side should lead in standing, pivoting, and sitting. So underline there. That's the last two sentences on there.
What'd you say?
The last two sentences in that G up under the picture. And when they are, say they do have a bad leg, and they're going to sit down, this leg needs to be held straight out when they sit. And then they sit. And it actually takes a lot of muscle on the other side of their body to compensate for a bad leg. I know that. But keep that leg straight when they sit down. What we are looking for that needs to be reported to the nurse: an increase in pain, any numbness, shortening, or external rotation. What would that mean? If it's shortening or external rotation, that's that. This is external. So if I'm this and this, what you gonna suspect first thing?
Wait, somebody one foot like that, another foot straight.
Well, this one's straight and normal. This one's,
It's broken.
yeah, broke it again.
Fractured.
Or fracture. Yep. That's what they're looking for. Abnormal vital signs, especially temperature. What happens? Why would your temperature be high? You have a fever. Why would you have a fever? Infection. Something's wrong. And you catch an infection in them surgery wounds, and those are dangerous. So we do not want that. Yes. If the patient cannot use their equipment properly, like if they have a walker and they're using it wrong, or if they have crutches and they're using it wrong, they need to learn how to do that correctly. If they're not following doctor's orders, if they have any problems with appetite and any problems with strength or their ability to walk when they can. We already know that they're going to be in bed for so long, but we're going to get them back up as soon as that doctor says we can, because if you let them stay, then they do. That's what they do. You don't go bring grandma and always use it, because you know how you would help grandma. You're going to bring her breakfast, lunch, and dinner, so it won't hurt her, but it will hurt her in the long run. Total knee replacement is kind of the same, but not so much. Not so much damaged in total knee replacement. But in the guidelines for total knee replacement, they're going to tell you to put on some stockings. If you're not putting on stockings, you need to do the ankle pumps, and all these ankle pumps are doing. And they wanted me to do that too with my foot. Ankle pumps make your muscles work, which makes your veins work, which makes circulation so much better. Because if you're not moving or making yourself think you're moving, then blood clots can form. And that's why anybody ever had a baby and it looks like a big old giant blood pressure cuff, but it's on your leg, and they put them on your legs, and that's what it is. It's the real compression. It like blows up like a blood pressure cuff, and then lets you go. But it simulates you walking. And that's why they do that, because they do not want you to catch it, especially after any kind of surgeries below the belt.
Get blood clots and all.
You get blood clots easily. So we're trying to avoid that with those. They call them compression stockings, or sleeves. I think they call them sleeves in the hospital. Perform ankle pumps. That's that next G. Encourage fluids anytime anybody's doing anything. Even now for y'all, I'm going to encourage fluids at least 60 fluid ounces a day. Assist with deep breathing exercises. Ask the nurse to give pain medication before walking. And report any swelling, heat, or deep vein tenderness. What if I got a deep vein tenderness right in the back of my leg? What do you think that's going to be?
Fracture.
That's what we're trying to avoid. It's right in the back of your leg. It's not your bones.
Somebody have vein arteries.
That's a deep vein thrombosis, which is deep DVTs. If somebody has a DVT, it's very dangerous, because that can dislodge and go straight to the lung, kill them. That's what they're trying to avoid, is a deep vein thrombosis when we are we've had surgeries or anything going on below the belt. Deep vein thrombosis. That's what we're looking for, and that's why the compression stockings. That's why everything else. You got to get them moving, because what else is going to happen if they're not moving? They can get pneumonia, urinary tract infections.
Bones just grow back the wrong way.
Bones can grow back the wrong way. If
Or you
if
just can't
they're
move
not
it,
helping them. Sometimes that happens. We really try to avoid that, but that's why we do range of motion exercises. Only when ordered to. But if they tell you to start doing range of motion, they want you to do that. Because people, just like I can't do a split today, but when I was in 8th grade, I did a good split. You lose your elasticity. You lose that. And as you age, it goes a lot faster, especially with injury, because it's going to heal up, and then you're going to have to work it back out. Describe the nervous system. So what is the nervous system? What does it do? Underline that second sentence. It controls and coordinates all body's functions. That's what it does. If you look in the picture, you see the brain and the spinal cord. They call that the central nervous system. And then everything else that's coming from the brain and spinal cord, they call that the peripheral nervous system. And all of those play a part in your nervous system. What else is included in your nervous system? Any sense organs. What are your sense organs?
Smell, taste.
There you go. Smell, taste, sight, feel. All of those are also part of this system. The nerves go there. Your body says, okay, that's hot, and pick it up. And that's your nervous system. Normal changes for aging. Underline these. Your responses and reflexes slow. Sensitivity of your nerve endings decrease. And I will give you this clue for all of your normal changes of aging. Doesn't mean that things stop working, but they probably will decrease. Anything that says increases probably is not your answer. If it decreases, that is probably your answer. Estrogen decreases, calcium decreases, insulin production decreases, sperm decreases. So that is probably correct. But if it says any of those are increasing, not so. Okay. How the NA can help. We need to write notes because this is their brain. We need to write notes, tell them to give them a to-do list or a reminder list. I need to do that now. But that is part of the exercise for the brain. Let them look at photos, let them remember stuff. Keep their brain working also. Observe and report. These are what you need to tell. Fatigue or any pain with movement or exercise, any shaking or trembling, inability to move one side of the body. What could that mean? Stroke. And that's where the stroke happens, right there in the brain. Your cerebrovascular accident, right there in the brain. We touched on it in chapter 2, but this is where it's happening in your nervous system. Dizziness, loss of balance, difficulty swallowing, bladder changes, depression, memory loss. Remember, also, there's so much happens here. Dementia, Alzheimer's, all of that is included in your brain. Any unusual, unexplained behaviors, decreased ability to perform their ADLs. Now we move to stroke. We touched on stroke, and they talk about it a little bit more here. Remember, it's your cerebrovascular accident. It occurs when the blood supply to part of the brain is blocked or blood vessel leaks or ruptures. So there's a clot going through there, or it's leaking and rupturing inside the brain. And all those are dangerous. With this type, the blood supply is blocked. Without blood, part of the brain does not receive oxygen. And so whatever it is blocking, that's what's not receiving oxygen, so that part of your brain dies or is damaged. And that's why strokes are so dangerous, because it's messing something up in your brain. And hopefully, sometimes a lot of the difficulties are caused by swelling of the brain. And once they get the swelling off the brain, a lot of times those people regain their use and stuff. If those brain cells are dying or killed, and that's pretty much what happens. Those are very hard to come back to. So, sometimes strokes can cause paralysis. So know these definitions. Paralysis means paralysis on one side of the body is hemiplegia. And I always think of the world, you got your hemispheres. So half of that is a hemi. So hemiplegia, that's one-sided paralysis. So paresis means weakness, so that would mean one-sided weakness. And know the different definition of that. Paralysis is that numbing, can't feel, feeling. That's paralysis. Paresis is weakness. Sometimes you're just weak, and you got and sometimes you can gain that back. Trouble communicating thoughts through speech or writing called expressive aphasia. And to remember that, you cannot express yourself. You can understand. I can understand everything you're saying, but I cannot get correct words out. So that is expressive aphasia. Receptive is just opposite. I know what I'm saying. I'm understanding. You can hear me. You can understand what I'm saying, but everything coming out your mouth is just gibberish. And that's how your brain works. It's crazy like that. But that is your receptive aphasia. That means what you're telling me, I don't understand. But what comes out of me is making sense. That's your receptive aphasia. A lot of times, they'll have bowel or bladder control problems, confusion, memory loss, tendency toward one side of the body. They call that one-sided neglect. They just don't take care of that side. Sometimes they have emotional lability. They are labile. Labile means that they change. They can be all happy one minute, and then next thing you know, they're just crying. Or one lady that had stroke at our job, she actually ended up quitting because she was just crazy. But people would tell her something, and she would burst out laughing. And then don't give her about 10 minutes, and she'd be just boo-hoo crying about nothing. And all they could explain was that she had 2 strokes. And she said, and she would do it at inappropriate times. And she ended up just quitting her job, I think she's on disability now because of that. Because it made her so labile, which means changing emotionally. And she quit. Yeah. And that probably hurt her feelings more than anything. Then she'd cry about stuff, you know. But people cry because they're so happy. So that might have slid by. But yeah, they're laughing at things, especially at work. Somebody coming and tell you something that's really dire. And we could work at a rehab and a trauma center, like emotional trauma. And she can't be doing that. Difficulty swallowing. Remember this? We know this definition. DYS, difficulty. Aphasia means dealing with your esophagus. You swallow through your esophagus. So difficulty swallowing. And that's what a lot of times we're watching. Even when we're feeding our patients, we are watching them, making sure they're not going to choke on their food. And that's what you're worried about when you're doing that. Sometimes they have speech problems. They have to go to a speech therapist to help them speak again. Their tongue gets really very lazy. That one side just slobber. They do stuff like that because that one-sided weakness. I had speech therapy for my W's and R's. I used to would say like turn white. I mean turn right. I still get tongue tied. Yep, me. That's it right there.
Yeah, Steve.
That's where I don't know where I got mine, but that's I went through all the way through elementary school trying to teach me how to talk. Residents with paralysis, weakness, or loss of movement will usually have physical or occupational therapies, and that's so we can get them back.
What's that? Oh yeah, the OT. What's that?
Occupational therapy. Normally, they are the ones that's going to do the
I know.
compensation.
Which one was the one that teach you how to adapt to things?
Your adaptation now, but it depends on how you're learning. The adaptation is actually with adaptive equipment is your occupational therapy people.
What about the PT again? What's PT?
Physical therapy.
Physical therapist teach you how to walk and stuff.
Yeah, physical therapy gets you back with what you got.
And the other
OT is going to try to adapt to whatever you can't quite get.
I get those two slowly.
Yeah, a lot of people do. I used to always, until, when you get into talking about this, you'll learn. Never refer to that side as the bad side. We know that.
What you supposed to say? The weak side?
The weak or involved. Or involved side. I just say, let me get that right leg. Or, let me get that leg. I don't call it out or anything. They know it's bad. They know it's weak. And we know it too.
Why you can't say bad?
Because that's just a bad word. It's for their, it's for their feelings. You don't want to hurt their feelings.
Yeah.
Speech therapists come out and talk to them. But we've got to remember what our speech therapists do also. They evaluate swallowing abilities. Underline that. That is another, we already know they do speech. But they also evaluate their swallowing ability. Right up under, we're on page 83, that second G, middle of that paragraph. They evaluate that swallowing ability. They're the ones that's going to say thickened liquids or soft foods or whatever, but they're the ones that's going to do that. They may be confused. Make sure we still encourage independence for their self-esteem. The more they can do for themselves, believe it or not, people like to have things done for them. That's if they can do it for themselves. But if they can't do it for themselves, then they're always having to rely on someone else. That affects your self-esteem. Yeah. So try to get them to do as much as they can for themselves. Always check on their body alignment. Their body alignment is properly in straight lines, straight legs, straight arms. Their feet should be up at a 90-degree angle. Their hands down. That is proper body alignment. Skin care, we got to pay special attention to. What if they have paralysis? They don't feel. So we're going to have, not only we're going to turn a patient who cannot turn on their own every 2 hours, but we're going to check on that skin every 2 hours too, because we do not want pressure ulcers to form. Adapt procedures when caring for them. Remember which side is weak, which side is not, which side to dress, which side to undress first, and you'll be fine. And that's them having an example of her weak side is her right side, so they're going to transfer to that wheelchair with her strong side. So her strong side is leading the way. That weak side will come. When assisted with dressing, underline that. Dress the weaker side first. We know that. Dress the weaker side first. And undress the stronger side. Remember when assisting with communication, sometimes these people cannot talk. Maybe they are the ones who've had that terrible stroke and only can blink their eyes. One blink for yes, two for no. One finger up for yes, two for no. Whatever, however you can get them to talk or communicate with you is a good thing. Most of the time, with most of your residents, you're going to want to talk to them. So you ask them open-ended questions. How was your day? And they can't say yes or no. But for our stroke patients who can't really talk so much, how was your day okay?
What are those questions called?
Closed.
No.
Closed. Yeah. You got open where we have a little conversation. Closed. It's just that yes or no. Give residents time to respond. Sometimes using a pen and paper. Maybe they can't talk, but maybe they can write. So maybe they can write it down. Again, you see that's that page 84 with that card. That is a useful card. Maybe they can point at what they want. Some way try to find some communication. Parkinson's disease is a progressive, incurable disease. It means the disease gets worse with time. It causes a section of the brain to degenerate. It affects the muscles, causing them to become stiff. It causes stoop posture and a shuffling gait. Underline that. What you will mostly remember with your Parkinson's, those are the ones that you hand them something, they're like this. And you're like, oh my goodness. But what we would do, get them a lid, get them a straw, so they will not make a mess. That's what we really think about with our Parkinson's patients. Yes. They shake a lot. And your hand over hand method, that's what I call it, and I think the book calls it that too. You can hold their hand and it keeps a little bit of that shaking going on so they can drink on their own, But even the the little toddler cups with the little lid, those are helpful. Anything that they would feel a whole lot worse if they spilled stuff all over the place as to having that cup like this. But type of adult sippy cup. Same kind of thing, so they will not waste everything while they're shaking. They also are the one with the little walk. They walk like this. They got the little shuffling gait is what they call it. And the pill rolling. They're the ones that's got the fingers, they like something's between their fingers and they roll a pill. The guidelines for Parkinson's. The residents are at risk for falls. Make sure you protect them from falling. Parkinson's and that little shuffling gait they got, sometimes they're weak also. They fall easily. So try to protect them from falling. Help them with their ADLs. Encourage them to do their self-care. Even though they may be shaken to death, try to let them do as much as they can. Tell them to concentrate on being still. And sometimes it'll work, a lot of times it doesn't. But you give them that time to try. Multiple sclerosis, most of the times this is diagnosed in their early 30s, early 20s. And what it is, imagine you have a wiring system, and that's what you got all the way through your body. All this is just wires. You got wires that lead here to your hand that says, okay, it's hot, pick it up. And that's what your body says. Then you've got your nerves. So that's your nerves. So imagine little spots in those nerves. And what happens at them spots, if you know a nerve doesn't really connect, they've got little electricity that jumps it to the next nerve and to the next nerve. And it's just a little synapse in there. And something happens with multiple sclerosis in that something happens and it goes the wrong place. So you may be trying to pick up your arm, but that synapse says, okay, we're not going to do that. You don't even pick up your arm. And or it makes it hurt real bad when there's no pain really going on. That is what multiple sclerosis people have going on with them. Something's going on in that synapse and it's taking it the wrong place. It's going to the wrong nerves. And a lot of times it causes that pain. Imagine, and that's the sclerosis. Sclerosis actually means like knots, scarring in along that nerve. So sclerosis is a scarring. So when you have that, the nerves don't act right because it's like you're stopping the flow of real electricity. Because that's what we got. We got stuff going on all the way through our bodies to make it do what it does. Assist with ADLs as needed. Be patient. Give plenty of time to rest. A lot of times those people get tired real easy. Just give them a chance to rest and then we can start again. Maybe you've got chairs or something throughout the way. Make sure we prevent falls and don't let them be stressed. Stress causes a lot of anxiety, causes a lot of problems with your multiple sclerosis people. It actually aggravates their symptoms. So we try not to stress them out either. Head and spinal cord injuries. A lot of times people have been in a diving accident, sports accident, falls, cars, motorcycle, industrial accidents, war, criminal violence, which causes head and spinal cord injuries. What I've seen a lot is gunshot wounds. People getting shot in the back. Next thing you know, they're in a wheelchair because they shot them right on their spine, so it causes them not to be able to walk. And depending on where that damage is along the spine is how bad they are. If you get shot lower in your back, you're going to have lower chances of having more problems. The higher it is, the more problems you're going to have. The lower it is, the less problems. So if you get way up here in your neck, imagine the problems you're going to be having. A lot of people that have those real neck injuries do not. They're paralyzed head down. But if it's on down in their back, they're fine. If they get way up in the neck, it gets into your lungs. And if you get up there, you're not going to survive. They're going to have you on a ventilator and you're just going to be living there. A lot of these people can still think. They just cannot move anything. And I'd hate to be in that situation. But that's your spinal cord injuries. So, we already learned a little bit. So, paraplegia would mean what?
Lost the function of the lower body.
Of the lower body. The para, meaning I always say para legs.
I like legs in
Yeah. And legs, right? But, what does quadriplegia mean? You got 4 body parts involved.
What's trunk? Is that my leg?
Your trunk is your chest and your body. That is your trunk. So quadriplegia means everything. All 4 of your extremities are paralyzed. Even your trunk. That means they had some high damage. When somebody's high, the higher the damage on their spine, the more the damage causes. The lower, the less. People I've seen jump out of a swimming pool or jump, into the swimming pool, hit the bottom. They saved them from drowning, but now the guy can't. It's just lays there all day. Can't eat for himself, and he is barely there.
My cousin had a bad motherfucker accident.
Motorcycle.
And now he's like, I don't know, he still think he's a teenager.
Yeah. This morning it was a wreck. It was a wreck like going to, I just went to the Boston. You heard about that wreck?
Mhm.
That man literally hanging out of police car windshield. Like,
Yeah, they're trying to figure out what happened. Did he just walk out into
I
the
don't
traffic?
know, body hanging out, leg in the middle of the road. It was like one of my coworkers' uncle. She called her job this morning. I answered the phone. She was just so devastated.
Yeah.
She was like really hurt.
People actually sat there and recorded
the
it.
police hit him?
Girl, it's video. I'm finding it.
They say he walked straight out in front of the police car. And it looks like that because he is in the windshield of the police car.
Head, butt hanging out of it.
Oh my God, I bet that scared that man. The
I would
police
have
officer.
scared
Oh
me.
my
I know, but I know that people gonna try to turn it into a
Yeah, I hope that, you
black
know,
on white crime, just like everything else. But that ain't like that.
I bet they will have, if anything foul was on that, it would be that he had to come off the road to do that.
Mm-hmm. Cause they in a ditch. They're in the car. It was in a ditch. Or
I seen it in the
off
middle of the road.
When I seen it, he was kind of pulled over to the side. They got some movement. But I was
So
just
we'll
like,
see.
dang, how the heck?
Guidelines for head or spinal cord injury. Give emotional support. Safety is very important. Be patient. We know these things.
Yes.
Underline 1, 2, 3, 4, the fifth G. This is your magic number. Assist the residents to change position at least every 2 hours. That's the magic number.
So what
If these
happened
people
if they
can't
get-
move, we
You
move
gotta
them.
move down for 2 hours.
What was you about to ask?
What happens if they get like aggressive or whatever?
That's what we're gonna avoid. That's why we're gonna
What
move them every 2
What
hours.
happens if they get it, like, if
Somebody's gonna get in trouble if they've been in the hospital the whole while. Cause
I know
it shouldn't
this-
happen if we are steady.
If we do your job, that's why she said when we do stockings, no wrinkles, no nothing. But what if you put it on right and then they mess
And
it
that's
up?
why we still check them. We give them an eyeball every 2 hours. That's it, even if you don't have to do anything else with your patient. Try to move them, eyeball them every 2 hours. And just make that round and come on back. Sometimes you won't even have to do anything, especially your afternoon, later afternoon, like
We do a night.
or midnight. That's what we're checking to make sure they're dry. We're making sure, probably so. We're making sure they're dry, that things are not cramping up on them, getting all wrinkled on them, and making sure
They have no wrinkles in the bed.
and we gotta try to make sure we check that too.
But you do vital signs at nighttime too, or you just let them sleep? You gotta wake
No
them
vital
up.
signs. If it's ordered, we're gonna do them.
Um,
Hopefully, you know, like when you're in the hospital, you don't really, you be like, get
Yeah.
them, you know, and that's what they do too. Sometimes they have the loss of the ability to empty their bladder. They may have a catheter. The number one thing to remember about a catheter is keep it below the hips. So you hang it on their bed, on the below.
at the bottom.
Mhm. On a non-movable part of the bed. Don't put it on the rail. 'Cause the rail, somebody might pick up the rail, and there goes that urine going back into their bladder. Put it on a non-movable part of the bed, and that's how Fred's is back
Do
there
people
too.
walk around with catheters?
People do.
Cause I know I seen a guy, he came to church, he had one out, that's disgusting.
Well, don't say that.
I didn't
If
say
you
that.
had a problem like that, you wouldn't think it was so disgusting.
Well, why would you, like the bag?
So where was it?
The bag was like on the outside of his clothes.
Yeah,
Like,
normally most of the time
his belt loop.
they will do that, but they're not. They can do what they want to with it. But most of the time, if people are trying to be discreet, a lot of people have those urinary catheters tied to the side of their leg.
Yeah.
So when they clean their own catheter?
Sometimes they're toting it around. Some people go home with the straight catheter, so they'll give you, 30 catheters for a day, for a month. So you use that one
You gotta
catheter
change your own
back and forth.
catheter.
People do. If their bladder does not
Put your own
work,
catheter in.
I know somebody they will
Yep.
and
People that don't want to walk around with a
The
catheter,
bag.
they'll self-cap. That's what they call it,
but
self-cap.
it's actually poo in the bag.
That too.
What's that?
Yeah. Self-cap is when you actually, you go into your urethra and
Put your own catheter in.
make yourself urinate, and then, go about your day. A lot of people don't like
But what if you
like a
got-
catheter drainage bag on them all day.
I know
And
somebody,
and you would do that if you was to get urinary problems right now. You would not want that. You would have a so you can go to the bathroom, take your little. It's a little, very flexible, very thin, tube, and you would put it right in your urethra, not your stuff, in your urethra, and put it in about 1.5 inches. Drain your bladder,
If you don't drain it.
and throw it away. Or that's if you got money like that. Most people don't have money like that. They reuse it.
What if you don't do that?
Then you are gonna bust and blow up, because if your kidneys are working, your bladder is gonna grow, and you're gonna start having pains. You're gonna start hurting. You're probably gonna get a urinary tract infection, and you're gonna mess yourself up.
Lord.
And if it was, and that's what I would do in my age. You know, we wouldn't want to have a urinary drainage problem.
Bag of pee on
Yeah, we would do the straight cath, because there's a lot of people in wheelchairs that don't like that catheter bag that's hanging on that wheelchair. They hate it. Sometimes they'll put it on their leg, but a lot of times if they are able and their hands are just as able, they will cath themselves, especially a man. You know, he's right there. All he got to do is da 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 da.
I bet that, yes.
You know, after a while, it doesn't hurt so bad because they tend to open up that little hole.
It hold you wide.
Yeah.
It's still going in.
Because they've got to have a little opening to make it work. But yeah.
I bet that-
So remember, where does the catheter drainage bag go?
On the non
Below,
part
on the
of
non-movable part of the bed,
the
below.
waist.
There you go.
like, so
Where
what
is
is it?
it?
It's not there. It's not here.
No, that's right on the.
It might be, but I'm just teaching.
On the low?
Difficulty, confidence, shallow breathing can also result in pneumonia. That's with anybody. So if anybody's laying in the bed, what are we going to try to do? Move them around, get them up, sit them up, lay them back down, sit them up, make them move some kind of way. The nervous system, the ears, eyes, nose, tongue, and skin. You will not have to label them, but I need you to know that they are in the nervous system. Your ears, eyes, nose, mouth. All of those are part of your sensory system, which is part of your nervous system. Normal change of aging. Your vision and hearing decrease. Sense of smell, taste, and touch decrease. Sensitivity to heat and cold decrease. So what are we going to do for our older people?
Keep it warm.
Keep them warm. That's about number one. You're going to walk into their room and you'll feel like you're in a sauna, but they are comfortably at home. And that's what they are. They're in their homes. So do not mess with just because you're going in there, do not adjust their temperatures. You're just going to be in there, take care of them, and you're going to leave back out. Let them keep their temperature.
Home
And
has to be hot.
Yes. My auntie too, Lord have mercy.
and they live like that. Even my grandmama, we were halfway raised without air conditioning, without heat, because that's how they believed. You know, you get up under your cover and breathe hard. That's what you do. Or go get in the bed with your sister and y'all huddle up together. You know, they didn't believe a lot in running that electricity, especially when you wasn't raised with electricity. You was raised with fireplaces, stuff like that. And you know, that's how you was raised. The lights went out, and that's okay. You know, I'll get to town to go pay the bill. I go, what? Can you please go pay the light bill, man? But she wouldn't let it go out like for days. It would be like one day or like a night, and then she'd pay it in the morning or something like that. But she's about as bad as me with light bill. Vision impairment. What you need to know what a cataract is, that's about in the middle of that sentence, or in the middle of that first paragraph, under vision impairment. On 87. A cataract is a clouding of the eyes. If you've ever seen anybody, they got really gray. I'm not talking about the pretty gray little lens where it's brown. It's gray, like the whole thing is gray. And when it's bad, it's bad.
My great uncle had that. Like, it's cloudy, real cloudy.
Yeah, they can see through it, believe it or not. That man on that end down there that is doing that woodworks, he's got cataracts bad. He actually put up my sign, and he told me to hold the sign right here, and he's got this drill thing in his hand. And I was scared for a second, like, can you see, man? And I was having to hold up the sign so he could drill it. And but they can see through it and they adapt to seeing. But they can have surgery and get a new lens there. They call that cataract surgery. And some people have to go get that done. Or they can have glaucoma. Glaucoma is just like high blood pressure, but it's in the eye. It's extra pressure in the eye. Something's causing that pressure in the eye. And they got medications for that. And it's actually like high blood pressure for the eye medication. And we got to watch for that too, because if they have that and they don't take their meds, they will damage their eyes. Those are some little bitty veins in there. Just like diabetes. Diabetes can mess up your eyes too, because there's so very little bitty veins in your eyes that can mess up.
Mine got worse since I've been diabetic.
Will you? Your circulatory system. What is included in your circulatory system? You got your heart, your blood vessels, your blood, all of that in that picture there. Heart, arteries, and your veins. What are normal changes of aging? Underline, your heart pumps less efficiently. Underline that. When I say underline, I know that's going to be on a test somewhere. That's your hints and clues. Blood flow decreases, blood vessels narrow.
Wait, what was that again? The heart?
Pumps less efficiently, right up under the picture. How the CNA can help. Movement and exercise should be encouraged. You want them to exercise their heart. If you're not exercising your heart, it's just like not exercising your legs. It's not exercising nothing. So you've got to exercise your heart also. And that's how we're going to help them. And lifting weights, believe it or not, is a wonderful, wonderful thing that helps all your moving body parts, all your blood flow and issues. If you lifted just a little bit of weight, doesn't even have to be a lot. Just add a little weight to your stuff, and it will help everything a whole lot better. Observe and report. This is what you want to tell somebody. If there are changes in their pulse rate, tell me what the pulse rate should be.
60 to 80.
60 to 80. How about any weakness or fatigue that needs to be reported? Any loss of ADLs? If they're swelling in their ankles, feet, fingers, or hands, or edema, what would that mean? If they're swelling, that means
Something.
what's happening to their circulation.
It ain't circulating. The water ain't getting out.
Yeah. It's just hanging down there because the circulation that brings it back is not working. That's why a lot of people, when you're elevating your legs and stuff, that helps. Even just by gravity, it helps that blood keep flowing the way it should. Chest pain, weight gain, shortness of breath. What could all that mean? We're talking about the heart now. If they're having a chest pain, what's going on with them? Heart attack. Right. Heart attack with your heart. What is another name for heart attack?
Cardiovascular.
No.
Cardiopulmonary. No. Cardio something.
Myocardial
What is it?
infarct.
Infarct.
It is an infarct. Y'all done messed me up, made me forget. Myocardial infarction.
Oh, I see it. Or a heart attack. MI.
Right. We're getting over there. But those are the things you need to report, because you're talking about our circulatory system. We need to report all that kind of stuff. Any swelling, chest pain, weight gain. I mean, something's happening where they're not getting rid of their waste. Hypertension. It starts at what numbers? What does hypertension start at?
Over 1 something.
140 over 90. Underline that. Anything 140 over 90 and above is hypertension. What is pre-hypertension?
150 over 90.
Nope, this is before hypertension. This is just a question. It ain't on there.
Oh man, I'm looking.
I see you.
120.
120 over 80 to 140 over 90. That is your pre-hypertension. They're going to tell you to start exercising, eat right, eat less salt. That's your pre-hypertension. Anything 120 over 80 and above. You'll have a test question that tells you and asks you which one of these blood pressures are normal.
120 over 80 is range normal.
That's normal. Anything above 120 over 80 all the way to 140 over 90 is pre-hypertension. And anything 140 over 90 and above is hypertension. So put that in mind. As you get older, blood pressures go higher. I don't like to say that that's normal, but they're trying to say that is. But anything over 140/90 needs to be reported. Because if they continue and they don't have blood pressure meds, they need to be on blood pressure meds. All the time. Hypertension can develop people of any age. Underline that. That is anybody. It can be any age. Arteries may become hardened or narrow because of the blood or buildup of plaque. And those are your pictures. And you see how bad it can get. That's what we're trying to avoid. That's why when people have cholesterol in their blood, we're going to get them to eating right. Oatmeal, exercising, and probably some cholesterol medication. Because you do not want your veins to be looking like that. If you do have hypertension, it may damage your heart where it's not pumping correctly. You may have a heart attack. It's not going to be pumping correctly. So it tends to hold on to water when you have that. So they give you a diuretic. Underline that. That's what it is, a water pill. Diuretics are a type of medication that reduces fluid in the body. And guess what? What's going to happen in about 30 to 45 minutes if your patient is on a diuretic? They're going to have to go to the bathroom. So just know that. When you seeing someone walking around, you know they're taking water pills. And your nurse just gave them a water pill. You know in about 30 to 45 minutes, you either need to get that patient on a toilet stool or get ready to change them.
What do we call the diapers? Not diapers, they're
Briefs,
underwear.
panties, but not diapers,
Not diapers.
not Pampers. Yep. Coronary artery disease. Coronary artery disease occurs when the blood vessels in the coronary arteries narrow. This reduces the supply of blood to the heart. It deprives it of oxygen and nutrients. So you've got coronary artery disease. Your veins are narrower, so it's not getting all the oxygen and nutrients it needs to get to the heart. And so it causes CAD. Sometimes that pain or that problem can cause chest pain, pressure, or discomfort called angina pectoris. Underline that. Angina. Angina pectoris. So pec meaning like the pecs, like when the guys work out, their pecs. That's what these are. And that's what that is, it's chest. Angina, pain. So pain in the chest is angina pectoris.
Oh, never mind. Cornea.
What you say, Angela?
Angina pectoris, the definition. So, if you look at your picture on angina pectoris of the heart, you can tell right at one point, it doesn't really show well, but they're showing you a vein. But just imagine there's a blood clot or there's a narrowing right there. And everything that vein supplies is not going to be working correctly, or a clot's going to soon happen. Something's going to be bad. And that's what happens. The higher, again, if it's up in the big branches of your heart and you get damage there, then you're going to be worse off than the person who has a heart attack on down below. So that's why some people they're fine with their heart attack. Okay, we had a heart attack, we're going to move on. That's because they got plenty of working heart muscle so they can keep going. A lot of times they'll get them into the heart cath lab and they'll put stents that opens up those veins so it can flow properly. And that's what the stents are.
What's that thing? A pasteurizer? What is that?
Pacemaker makes your heart beat at a constant pace. Sometimes there's a little node in your heart that tells it when to beat, pretty much. It's an electrical part, and it tells it when to beat. Sometimes that thing gets all messed up from different reasons, but that's what your pacemaker does. It tells it when to pump, and that's your beat. Underline for guidelines for angina pectoris, rest is extremely important. They're going to get tired because they don't have as much oxygen going through. They may have damaged part of their heart, so they're going to have that real bad trouble. They get tired easily. Or they may give them, if they're having that angina pectoris, they may give them a medication called nitroglycerin. That's under that next G, that big long G. Nitroglycerin. It's right about the fourth sentence down. It dissolves up under the tongue. It will open up their vessels so big, because they're thinking it might be a heart attack, so they're going to open up them vessels, make them bigger. It also gives you a very bad headache because of that opening. It also opens the veins in your head. It opens it everywhere. And that's what nitroglycerin does. We cannot, as a CNA, we cannot give that to them, but we can hand it to them. They can take it themselves. But we cannot put it in their mouth. Anytime, any medications, we cannot put them in their mouth. We can give them the medication, they have to take it. And I understand and remember that when they ask you questions about medication. You can remind a patient. You cannot really set it up, but in case of nitroglycerin, we can hand it to them. They may say, oh, please go get a nitroglycerin, and you just go get it. But they will have to actually put it in their mouth.
Can you overdose kill yourself by taking too many drugs?
Probably could. You know, most people just take it when they're in that terrible pain, and they know it's that pain. Because you can take up to 3. If up to 3 does not change that pain, then we're going to the ER because you're probably having another heart attack. They usually get it right after a heart attack. Sometimes, and that will lead up to, we was just talking about clogging arteries. Now we're talking about the myocardial infarction, which is the heart attack. When blood flow to the heart is blocked, oxygen and nutrients fail to reach the cells that in that region. In CAD, they don't get there as well. But in a heart attack, they just don't get there at all because something's blocking it, probably a clot. Something happened, and the rest of the heart dies. That it's not being supplied of their nutrients, and depending on where that is, it can kill you. And they always call, blood pressure is a silent killer because, a lot of people are so used to having high blood pressure, they don't know. They think it's fine. And they're so used to living with a high blood pressure. When you give them blood pressure meds, they don't like it because it makes them feel drained. So we don't want that to happen. Most residents who have an MI will be placed on a regular exercise program. We're thinking about fluids and it not flowing so well. So what kind of diet are our heart patients going to be on?
A no salt diet.
No salt and possibly, what's clogging their arteries?
Oh, no carbs.
Cholesterol.
No cholesterol.
No cholesterol, no carbohydrates. We're on page 90 at the top. So what are we going to do? We're going to encourage them to quit smoking because that in alone of itself makes all your blood vessels narrow anyway. Then you're on top of that putting cholesterol in there. You're going to be in trouble. Congestive heart failure, all can damage the heart, and that's what happened after a heart attack or after coronary artery disease. All of that damages the heart, and that's what gives you congestive heart failure, which means the heart pumps less efficiently. And that is normal in everyday living, but not when it is damaged. When it's damaged, that causes congestive heart failure. When the left side of the heart is affected, the blood backs up into the lungs. And when the right, it backs up into your legs, feet, or abdomen. So if you see a person who has got very bad swollen legs, and they tell you they have congestive heart failure, what is their problem? What side of the heart hurts?
Right.
Or is damaged? It's the right side. And the left, if they're coughing and they tend to get sounding very funny as they're breathing, that's that left side. Always remember left lungs. And that's a LPN RN question. Left lungs. But if you get that, you got a lot of your symptoms there. Although congestive heart failure is serious, it can be treated. They're going to give you probably, again, that diuretics to keep that fluid from building on you. Come on down. A low sodium or fluid restricting diet may be prescribed. That third G. Underline that one. They also get tired. They may can't tote stuff. They may can't climb the stairs. They may not want to eat such a big meal. They want to eat slower meals because they can't breathe well, so they don't want to fill their stomach up with food and then they can't breathe. And that's, you got to watch them. They get tired easily. We're probably going to measure their intake and output. We're going to measure their weight. When are we going to measure their weight? When is it recommended even when we're checking our weights?
At the same time.
At the same time with the same clothes, on the same scale, same time of day. And it's recommended first time when you wake up. We can tell what your body is holding on to. by that right there. And if you are that person who is, next thing you know, a lot of those people that, if their kidneys are not working, what are we going to put them on? Dialysis. And that's when we weigh those people to make sure that,
How many people have dialysis and have a big knocks in their arm?
that's probably the tube, the make-believe vein that they done put in there, or artery that they put in there.
Because this person, they have real big knocks in their arm. When they go to dialysis, you can't like.
That's probably the vein they put in there. They've got, it goes and it travels and it settles in their arm. But it's for better,
Does it hurt her?
It doesn't hurt as bad if they were having to stick their real arm all the time.
Does dialysis hurt?
They say it drains them of their energy, not so much hurt.
My grandma be so weak.
Yeah.
She can't drive.
Yeah.
Yeah, I have a friend. He come in. If he don't come in on this, he gets dialysis.
Yep.
He can't stay.
It drains them out.
But don't that's where they take all the blood out and they filter it.
Pretty much. They don't take it all. They take it a little at a time.
Yeah, he says it takes like 2 hours, 3 hours.
Some people up to
He
4.
just go to sleep.
Yeah. That's what they do.
Sleep in a chair while you're just taking blood.
Yeah, that's what they do.
So they have 2 holes in the arms. One for it to come in and one for it to
Oh,
come
fun, go out. Normally they can, normally it's one though. They go in and out on the same one.
My grandma had her one on the chair.
Yeah.
And they moved it to
Or is it like a
Yeah,
cord?
they start with the port in the chest, and then they go to the arm. Because it's much more likely to get infected up here in the heart area, and we don't want that. So we put it back in the arm. And then that's where you're a dialysis. And that, do we check a blood pressure on the person with a dialysis shunt in their arm?
No.
No. We're going to check the other arm. If that arm has one too, we're going to check the thighs. We got other places. And you try to go find you a thigh blood pressure cuff that is designed for the thigh. Yes. What sometimes happens with our people, they get peripheral vascular disease. It is a disease in which the legs, feet, arms, or hands do not have enough blood circulation. A lot of times they're the ones that, their fingers look bluish. That is your peripheral vascular. A lot of your older people get it just because out of age and bad circulation.
He'd be cold.
Yes, it makes your feet cold, it makes your hands cold. Some people have that disease that they just have it naturally, not because of disease or illness.
Like low iron make you cold.
Low iron to do that too. Yeah. Yep. Risk factors for PVD are smoking, diabetes, high cholesterol, hypertension, inactivity, and obesity. They want you to quit smoking, take medication, exercise, and do surgery. If you're doing any of those, if you're smoking, they just really want you to stop. And I know this as a teacher, but don't even start. Terrible. There's no excuse for not stopping, but for some reason, I just don't want to. But obviously, that's the only excuse I can give. Just like losing weight, I can't lose weight either. I guess I don't want to. I must be fine. Literally, I'm fine. But remember that for your peripheral vascular medication, exercise, and surgeries. Describe the respiratory. So, what does inspiration mean?
Like breathing in,
In. What does expiration mean?
out.
Breathing out. What's our numbers?
For, is it 16? No. 16 to 20?
16 to 20. Let's reiterate. What should our pulse be?
60 to 80.
140? No.
Pulse.
Oh, 60 to 80.
60 to
Oh,
80.
the beats of it. The beats of the
Pulse.
Oh, okay.
Pulse. 60 to 80. Blood pressure. Y'all got to learn your definitions too. What is blood pressure
BP.
range? What's the top numbers on your blood pressure?
120.
Nope.
120.
Nope.
140. Oh,
What is your range? That first page I gave you, the first day of class.
98.6.
90.
Oh, the range.
Blood pressure.
Down to 6.2. Wait. No, that's radial pulse or something like that.
Blood pressure. It's a range.
140 to 90.
90 to 140. There you go.
90 to 140.
And then that's the top number, and on the bottom number it is
60 to 90.
yes. Well,
Okay, so what's the top mean? 90 to 140.
I
Yes.
thought it was
And
140
then
to
60 to 90.
yeah.
But 90 on top of each other, I remember. 90
Yeah, they're on top of each other.
And then
I thought it
You
was
said-
140 tonight.
No, it's the lower number first.
It's on the paper though.
What'd you say again?
Lower number first. 90 to 140.
91, 40, 69.
69.
No, I thought it said 140.
Yeah, y'all take a look at that sheet again. It'll get the and how to write it also.
I really was asleep.
I got all my stuff in my
And how about temperature? What's your temperature start with?
96.
96.6.
0.6. Make sure it's 0.6.
7.
And then what would be your oral?
97.
And then your rectal, which is the most accurate.
98.6.
And then you add how much across?
2.
Okay. Got to get that in your head.
That's what I can remember.
Normal changes for aging for your respiratory system. Your lung strength decreases. Remember these decrease. Lung capacity decrease. Oxygen in the blood decreases. And that little voice weakens. That's when the older you get the little hello voice.
Soft voice.
You get that little crackling in your voice. That is
The baby.
that's by the by elderly. That is caused by aging. How you can help? Make sure you don't expose your people to cigarette smoke, especially elderly, and do not let them just keep the sick people away from your old people. That's all keep them away from your old people. That's just one rule of thumb. If you're sick, you don't need even go in. Sometimes if you got respiratory, they'll give you a mask. They'll have you working, especially if they're short-handed. But make sure you protect them with a mask. You might can work just fine, but you know, and walk around as normal people, but you don't want to even get them to even be susceptible to getting any kind of respiratory infections because they're already their normal age change is lung strength decreases, lung capacity can decrease, oxygen decreases. So we don't want to give them anything that's going to hurt them. So if you're sick, put you on a mask if you're going to go to work. Some people going to work anyway. If sick or not, they just going to persevere and make that check. But some people won't. But if you are, protect yourself. Protect people. Observe any respiratory changes, shallow breathing, or breathing through the pursed lips. What would that mean? If somebody, remember, anybody had Lamont's class? Or during childbirth, they tell you how to breathe. They try to tell you to purse your lips and breathe. The reason for that is it's holding your lung alveoli. That's some little bitty things in the bottom of your lungs that that does the exchange between oxygen and carbon dioxide. So way down there, and when you breathe like that, it creates a pressure that keeps those open for longer, so more exchange can happen. That's why they tell pregnant people to breathe like that. Older people who can't exchange so well, they kind of automatically breathe like that. And they will hold their lips, and it keeps them little things open better for more exchange. So if you see them doing that, that's probably something going on where they can't breathe as well. They could be pale, bluish, or gray color of the lips, arms, or legs. What would you think that meant?
Lack of oxygen.
Oxygen. If they're turning blue, they got lack of oxygen.
Like some babies when they come out, they get
Yes. And that's why they kick them and hit them and not kick them, but beat them, and try to get that circulation going.
They thought when they put so hard.
Because most babies, they don't have that same circulation inside their body. When it's a wonderful miracle when babies come out. When babies come out and it's like an automatic. This is wonderful world of the baby is living of you.
They never breathe.
And when especially that's why birth is much better because all them little veins. There's a valve in the lungs and there's a valve in the liver that closes off, so they can breathe natural air, and it has to close off. And the one that's in the heart sometimes doesn't close, and that's why a lot of people get that heart murmur. It's that little part that did not close, and it's supposed to close so it can pump correctly. So that's where that murmur comes from a lot of people. Yeah.
Amniotic fluid. It probably is breathing inside though.
Yeah, they're breathing, but they're breathing water. So when they go through and they have, they cut that umbilical cord, that's it. They are now going to have to breathe air. So all those little things, I mean, it's
Why
just
they gotta
a
make
miracle.
them cry?
They're trying to get that circulation going the correct way. And that's why that a lot of people have that murmur in the heart because of that. That it doesn't close all the way like it's properly, and then a lot of children grow out of that because it finally closes up. Chronic obstructive pulmonary disease, COPD. There's two types that they mention in here. You've got your bronchitis and your emphysema, and those are very much similar. Bronchitis is normally the first stage. Well, remember, itis means swelling. So bronchial is the swelling of your bronchioles, and those are those two big tubes right in the beginning of your lungs. Those are your bronchioles. And when those things get inflamed, you get to feeling terrible. You cough, and you know, you getting that chest congestion. That's your bronchitis. Wheezing, all the above. Yes. Sometimes it's caused from cigarette smoking. You'll be coughing up sputum, phlegm is what we call it.
It's just bad when she gets sick.
Then it leads to emphysema, which is a chronic disease of the lungs that usually results from chronic bronchitis and cigarette smoking. Other symptoms are breathlessness. They have a fast heartbeat. Sometimes they're going to get them and put them on oxygen as well as medications. Quitting smoking is very important. Then over a period of time, if you let things like that just sit and settle, they become chronically ill. Sometimes they get pneumonia. All of these are your lungs. Pneumonia, that's some Latin person probably. It's an illness that can be caused by bacterial, viral, or fungal infections. An acute inflammation occurs in the lung tissue. Clear liquids is okay when you're coughing up lung secretions, but if it's green, yellow, especially accompanied with some kind of temperature, that is dangerous. You need to get some help because that's an infection, possibly fungal or bacterial.
Being so cold outside, you being so cold, you get pneumonia.
Not really, but because of the moisturization in the air, it tends to get your lungs moisturized that much, and it's not the cold in the air, it's the way the air is.
So, why my older people be like, and one day it's hot, and this day it's cold, and you don't have, say it's cold one day, it's hot next day, but the next day when it's hot, you don't have no food left.
Yeah, or you get sick, or you
You'll
get
get pneumonia.
Then what this pneumonia was, you don't get pneumonia.
yeah, and it's because of the humidity in the air. One day it's hot, that means the humidity is dry. That means your body's adjusting to that. The next thing you know, your body tries to adjust to most of the time it's the humidity. And that's my theory that I've listened to several different doctors try to tell me their theory. But it's not really bacteria in the air that does it. It's what it's causing inside your lungs to grow the bacteria. You're more susceptible, especially when it's dry and it gets cold the next day. Now your lungs got dry. You're breathing in that same stuff. And then it gets cold the next day. Now you got the moisturizer and it's helping the bacteria to grow. So that's some theories about that. But that's what I'm most understood. It was not quite the coldness, not quite all that. It's the atmosphere that you're letting the bacteria grow. A lot of times when people can't breathe, they don't want to eat because they can't breathe.
Yeah.
So they eat small meals, so you encourage them to eat and drink. They may be coughing, wheezing. They may be short of breath, confused. They may be weak. They may be fearful because they can't breathe well. You know, imagine you thinking you might suffocate and can't breathe. And that's got to be a terrible feeling. So your guidelines for COPD. Colds and viruses can make residents very ill. Number 2, or the second G, underline that one. You help your residents sit upright or lean forward. Offer pillows for support. And that picture you see over there, that's how you need to sit them. Anybody that tells you they can't breathe, I don't care if it's a heart attack or they just can't breathe. You sit them up. That's your first step as a CNA. You can help them without having ever put any medication in their mouth. You can sit them up. Also give them plenty of fluids, because the more fluids you got, the more trash you got in your lungs comes out. The more trash in your blood comes out. If they're on dialysis, it's a whole different story because you can't just feed them fluids. You've got to be delicate with those, a whole lot different. Or if they're on restricted fluids, you got to be delicate with those patients because something's You can't flush them as well. You can't, it's kind of like you want to push water because water is natural and keeps your body clean, literally. You need water. Being unable to breathe or fearing suffocation can be very frightening. Help them keep calm because sometimes they can't breathe and you're going to have to go find some oxygen. And you're going to have to say, hold on, I got to call the nurse. Sit them up, get some help. That's not going to help if they don't have oxygen.
Remember I seen on movies?
Most of the time that's when they have it, when they're hyperventilating.
Yeah, that's the word.
Encourage as much independence as possible. Encourage pursed lip breathing. Underline that. That's that 1, 2, 3, 4, 5, 5th G over there under the picture. Because that will hold those alveoli open and letting all that exchange happen when it's harder not to do. Report any of these to the nurse. Temperature over 101. That means they got a fever. They got something going on. Fever, infection, virus, something is going on with them. Changes in their breathing pattern, changes in the color of their lung secretions, change in their mental state. They may get confused because they have no oxygen. Increased weight loss or excessive weight loss. Increasingly depending more and more on their caregivers. Number 6 is urinary system and related conditions, page 93. The urinary system is composed of 2 kidneys, 2 ureters, and a urinary bladder, a single urethra, and a meatus. And then just look at the picture. Those are your male and those are your female. Meatus. But underline what the urinary system does. It eliminates waste products created by the cells. That last sentence, first paragraph. And it maintains the water balance in the body. So underline both those 2 sentences. And you can look at your pictures. Notice that the female urethra, and that's what comes out the bladder. You see the bladder in both, right? The bladder for the female is so much closer than it is for men. And that doesn't even take the cake for a man. That doesn't even look like it's much a difference from the male to the female, but it's a whole lot of difference. For a female, you put the catheter in probably this much, and you get urine because you put it in just to their bladder. But for a man, it's got to go all the way through the penis, and then all the way up and up some more. And that is and you're gonna almost use the whole catheter tubing for a man, whereas a female, we get it probably. Right? We might have trouble. We might have to do something. I don't know the case.
Like it's bigger.
Sometimes if it is too much bigger, I believe they use the Texas condom catheter, but they can also order bigger tubes. Depends on what's the problem.
I'm talking about like the bladder in the picture.
What?
Like the male bladder bigger.
Oh, it does, doesn't it? But that's not too true. I think they're about the same. Might have to look that up somewhere.
But to find, like, my daughter, her right kidney is bigger than her left kidney. And to find out if that tube that connects your bladder to the kidney, to find out if that was messed up, they had to, like, insert some stuff to go back up into.
And put her up under the imaging.
Yeah. To figure out what was going on. She's hollering. So how long would you have to do that to somebody? You put it all the way up to that line, to the tube, or do you just put it in there and just let it blow up?
Usually they just put color in there, some kind of color to see the trace of how that color leaves. Mm-hmm. And so they'll put it up under the imaging so they can see how that comes out. And that's a lot of tests they do to just check to see for circulation, for damage, if it's leaking out into the body. I had that when I had my laceration for my spleen, and they confirmed it was leaking out into my body.
Can that kill you?
But yeah, that stuff would
That's poison your kidneys.
mess you up, and it hurts. It's really, really, really bad. It's anything it's gonna hurt, and they say it's poison, but that's part of your body. So that's under my questioning. I never thought of it like that. But normal change of aging for your urinary system include, underline that, bladder holds less urine, which causes more frequent urination. So now you got an older person with a smaller bladder. So what you think they're going to be doing?
Peeing every 10 minutes.
Peeing a little more often, urinating a little more often, voiding a little more often. Those are your words you're gonna start using. Urinate, void. You don't want to say pee. Yeah, we're gonna use urinate, void, or things, words like that.
You said void.
Void. Yeah, that means eliminate. How you can help: the NA should encourage fluids and offer frequent trips to the bathroom. Remember that urinary incontinence, remember that definition is in that orange box, is the inability to control the bladder or the involuntary loss of urine.
Which means they just pee
So-
at any given time.
Right.
Oh, hey, no.
Underlined, residents should be kept clean and dry. Number one reason for pressure ulcers is what? Urine.
Wet pants.
And they keeping them on there. We even for our babies, you know, oh, you feel the pamper, oh, it's got a couple more days, not days, but they can pee one more time. We should not do that. Anytime that urine is on there, that can irritate the mess out of them.
Yeah.
And imagine that's on an older person, just as well as the babies.
I have a question.
And imagine they are sitting on it and don't move from it.
Can it go inside their stuff?
They can, any kind of
And don't if
infection.
it
Mess them
go
up.
in there, you can get like a real bad infection.
Yeah.
Like E. coli, that's how E. coli.
All
gets
that kind of
into
stuff. That's why we wash even your babies front to back. You wash front to back. Then you wash your patients front to back.
you. Yeah, but what if it's in there? What do you gotta get it out?
They'll probably give them antibiotics.
No, I'm saying like, let's say I got a patient, and my patient has a bowel movement inside of their underwear,
Okay.
and they're sitting on it, and it is inside of their stuff. It's the female.
Oh yeah, we're gonna have to get it out.
Well, how would you know if they get an infection or not?
Oh, we'll know later. You do your best. Not even your best. You can get it out.
Would you tell somebody that it was in there?
And I think I'd tell the nurse, but they're not. They're gonna be like, okay, they're gonna make a mental note of that, and they'll probably watch out. But as long as you clean it out, hopefully it won't cause an infection.
How would you know? Like,
They're gonna start burning, itching, pain. Their urine is gonna be very dark or foul smelling. That's our first signs of urinary tract infection. But you're right, it could easily cause. That's why we try not to, and it happens just like it does with babies. It happens.
what happens to guys when they
They
get
get all that
urinary tract
everywhere.
infection?
Same things
Do
as
they
a
stop-
lady.
Do they itch?
They can yeast infection.
Like what
Guys get yeast
They get
infection?
yeast infections and
What be itching?
The top.
probably at the top and when they urinate.
So it itch when they urinate. So it itch when they urinate.
Probably itch the whole time like ours do. I don't know how they're gonna scratch it. They're probably itching the whole urethra. And probably I know the top. Haven't really asked anybody about the rest of it.
What I'm saying, I'm trying to figure out.
I'm through with y'all.
That's what I'm trying to figure out.
Hold up. I got it. Oh, this is.
Skin.
But I believe it ends up itching the whole thing. I
Oh,
haven't.
and I can't get to the inside.
I haven't asked.
Well, how do you even check somebody, a guy before that? You got to stick a Q-tip
Mhm.
inside of theirs.
Yeah.
Oh my, what, man.
Every time I've been very lucky. Every time I've had to stick somebody like that, I've actually had the patient wanted to do it himself. He didn't want nobody sticking him in his thing,
I wouldn't
so he
do
wanted to
it.
do it himself. He said, "Oh no, I'm gonna treat my thing better than you can ever," and he went
Yeah,
ahead
they probably
and did it himself.
You watched him now?
Yeah, I had to watch him because I'm the nurse, so I made
Turning point?
that turning point.
So he got to turn.
Are you like RN or something?
Mhm.
I'm about to say, did they CNA watch stuff like that?
Oh no, sorry. Now you might be able to watch it if the patient lets you, especially if you're that up and come and want to be a nurse type
Yeah.
person and want to see everything.
I do. I want to see
You know,
everything.
That they'll let you.
I want to be on that
most
show.
will.
Untold for the VR.
If it's a learning experience, not for, not none of that.
Ah.
You,
I'd be like,
Do it hard.
That would be me.
you're there learning. But someone will let you watch that, and that's always a good experience to learn
I
stuff.
know
like
that you have to ask first, you know.
Yeah, oh, definitely. Tell your nurse, hey, anything you want me to help you with, I'll help you.
I want to know everything.
Observe and report for your urinary system. Any weight loss or gain, Swelling in the upper or lower extremities, again, that's bad circulation. Something's happening. Maybe your kidneys are not working. Maybe your kidneys are not excreting the urine out, so it's holding on to all the waste in your body. Any swelling in the abdominal area, painful urination, incontinence, or dribbling. Any pain in the back or flank region. The flank region is just where your spinal cord is in your back. On the sides, right on the sides of that. When they say flank pains, that is your flank pain. Right there in the back, those sections there. Urinary incontinence can occur in residents who are confined to bed, ill, elderly, paralyzed, or have, underline this one, or have circulatory or nervous system diseases or injury. Tell me a nervous system disease. We've talked about nervous system. What was in the nervous system?
Your senses.
And your brain and your spinal cord and all your nerves. So what could have happened to give you a urinary incontinence?
A stroke.
A stroke.
Heart attack.
Those things. Not so much a heart attack, more stroke because that's in your brain. So the question that you're going to see
Yeah, where's it?
is
Where's
up under urinary incontinence. They have circulatory or nervous system diseases or injuries.
it? Oh, okay.
So is that a cause of urinary incontinence if you have a stroke? Yes. What we're going to do is offer a bedpan urinal often. Answer your call lights. When they need to use the restroom, go to them.
In the emergency room, they don't never answer the call light.
Yeah, they think you, I don't know what they think you're waiting on,
That
but
will be ringing forever.
page 94. Urinary incontinence is a major risk factor for pressure ulcers. And that is so real. Underline that. That is what that's why we check them every 2 hours.
What is that?
That's that first G.
What you said? Say it again.
Urinary incontinence is a major risk factor for
I don't see that.
There you go. The first G on 94.
Oh, I'm on 96. That's why.
Urinary incontinence is a major risk factor for pressure ulcers. So what is a major risk factor for pressure ulcers?
in urinary
Urinary
incontinence.
incontinence.
There you go. Okay. Cleanliness and careful skin care are important. Urine is very irritating to the skin. We are going to keep them clean and we're going to keep them dry. That is our goal. And we're going to check that every 2 hours. When they call on that call light, we're going to go see what's wrong. If they say they have urinated on themselves, we are going to change them. We are going to make sure that they stay clean and dry. And eventually you'll learn your patient. Maybe this one urinates every 2 hours. This one urinates every 4, and she only goes once a night. And you will learn your patients, and it'll help you
How often would
gauge
you
your
do-
day.
How often would you do pericare?
Period care, every time they urinate, every time they
urinate, you gotta
defecate.
wash them.
Yes. Don't you wash yourself?
I wipe myself with a tissue.
With a tissue, but we're going to keep them even
Every
cleaner and
time.
drier. We're going to keep them, they're going to be ready to go.
So you do that at your job now? No, you don't do that because I'm already.
Every once in a while we'll get a detox patient that can't